This weekend kicks off World Doula Week. It's aimed at empowering doulas to improve the health of expecting moms during pregnancy, labor, birth, and the postpartum period. And this week comes as the CDC says maternal deaths here in the U.S. are dropping, but there is a group that remains at the highest risk. We're going to dive more into this. And joining me for more is Latham Thomas, founder of global doula service Mama Glow and chief medical officer of HERS, Gynecologist Dr. Jessica Shepard. Thank you both for being with us to talk about this very important topic. Dr. Shepard, I want to start with you. The maternal mortality rate in the U.S. is higher than any other developed nation. So that's there even as rates are dropping. But Black women have the highest rate of any demographic. The CDC says Black women are 3 times as likely to die from a pregnancy-related cause than other women who are not Black. Why is that? And what can health professionals do to mitigate these rates?
Yeah, thanks, Janae. And again, this week is so very important when we think of the maternal mortality rates. But when we look at women and women of color, they have long-based challenges with improving maternal mortality. And we have racial disparities across all medical conditions that have been documented. So when we think of maternal mortality and morbidity, since 1935, this is when we recognized it and actually implemented this legislation to improve the health for all mothers, which clearly we have to do more work.
Latham, I want to bring you in now. For those who may be unfamiliar, what exactly is a doula?
So a doula is a non-clinical care professional that offers emotional support, physical support, education, advocacy tools. If you have a partner present, they're there to also support the partner too, and essentially ensure that you have the best birth possible, ensuring that you understand how to navigate the healthcare system and whatever spaces that you are working with your care providers, whether that's midwives, physicians, and ensuring that you have the best outcome possible. So these are people who are an essential part of the care team.
Yes, and can help a lot, as you say. But the challenge is that not everyone has the access or the funds to hire a doula. Some states have expanded Medicaid coverage to include doula services. How significant is that?
This is really important for a couple of reasons. Obviously, doulas are at the top of the federal agenda now, which is huge. But what it means is that increasing doula access means that everyone, including our insurance providers, need to figure out pathways to support and reimburse doula services. It does also mean that when we're thinking about this critical work, that we need to compensate doulas fairly. So looking at cost of living in different states like New York City, where it's really expensive compared to other places in the country, where doulas can have be able to do this work, but also be able to do it in a way that allows them to make a living wage, right? And so that's a big piece of it. But the most important thing for people to think about is doulas are here regardless of what your economic background is. So if you're not able to afford services, there are community-based doulas who offer pro bono or sliding scale services. It really should be a situation where everyone who wants access has access to the support. At Mama Glow, we offer services like this where people who are Medicaid eligible or who are underinsured also get access to doula care.
And I think when a lot of times when folks hear the terms like midwife and doula and OBGYN, they're thinking that they're all mutually exclusive or not necessarily working together, and that's not the case. And Dr. Shepard, to that point, a study from the Journal of Perinatal Education says, quote, many women are able to forego epidurals, avoid cesarean births, and have less stressful births with the support of doulas. Why do you think that is? And how does doula support medically benefit not only pregnant mothers, but doctors when they're caring for them?
When you think of the healthcare system, the system really requires that we are taking from the clinical, non-clinical aspect. And I really believe that we are able to improve not only the physiologic and the actual pregnancy, but the social, the emotional, and the psychological health of women when we think of doulas and midwives and also the clinician of the OBGYN. But you're right, that study did quote that there's a reduction in C-sections and also the care that's taken during the pregnancy and reduced epidural and anesthetic requests. But this is going to improve the mother's satisfaction of the birth experience, which is ultimately going to help in the postpartum phase for decreasing postpartum depression.
And Dr. Shepard, as we have seen OB/GYN and OB wards, maternity wards at hospitals around the country closing their doors and leaving women with fewer options, especially in rural communities, how important is it to have these additional providers who can help fill in the gaps and stand in where otherwise women could be falling through the cracks?
I think we have so many women that fall fall through the cracks already. And so when we have these now decreased opportunities for women to actually get the care during pregnancy, we really need the community to substantiate that foundation of what the pregnancy and the postpartum care looks like. And this is really where we see the advantageous benefits of doulas.
And to that point, Latham, talk about the challenges that doulas face, not only in being accessible for many women, but the workload. It can be burdensome. It takes a lot out of doulas.
Yeah, so the caseload can be tremendous, and in many cases you have doulas who are doing kind of like social worker-based work, right? And so they're managing caseloads or helping people connect to the social service safety net. They're working with people who are typically also categorized as high risk or high needs. And so that puts in a lot of emotional toll on people, and they're actually doing work that's uncompensated. And so one of the studies that we did in birth worker burnout really looked at key areas that impact doulas in the workforce and this sort of racialized and feminized care work that actually ends up being burdensome for doulas. And so many doulas leave because they don't have the support. Obviously, they're underpaid. And then things like, the traumatic experiences that people might experience in the healthcare system also impact the doulas because they're there to witness that. And so when we're thinking about designing solutions, it's really important to think through what works not only for the birthing individuals and families, but also what's going to help the people who are part of that care team as essential workers, such as doulas, ensure that they also have the care they need and the resources they need to navigate those systems. And also think about what it's like to enter into a system where you're not regarded as part of the care team. A lot of times doulas are given name tags to say visitor when they're actually a member of the care team. And so what if we change something as simple as that, like having an actual name tag that says doula, and then being acknowledged for that. So I think the safety and the dignity that doulas are also requesting as they enter into the workforce and into medical spaces is really important as well.
And even though the CDC says that the maternal deaths in the U.S. are dropping because the U.S. is still the worst, and compared to other nations, for anyone who is pregnant or is looking ahead to hope to get pregnant and they're considering a doula, what is some information that you think they should have?
Well, first of all, look to see where your local doula practices are, as well as midwifery and OBGYN practices in your neighborhood. Interview, do research. It's really important because this is a critical time and a very intimate time in your life. So make sure that you really get along with your doula and your care providers, because this becomes what we call your birth village, right? Yeah. These are the people who ensure that you have the best birth outcome possible. Also, do research about the place that you're potentially delivering, because a lot of people are really great candidates for hospital births, but some people would be better in home births or birth centers. And so ensuring that you have that knowledge base is something that doulas can help you do. Yeah. But also think about the entire continuum. What I want people to be thinking about is not just the birth itself, the postpartum period, which is where we see a lot of maternal death, as well as complications post-birth happen in that postpartum period. So postpartum doulas who provide support after birth are also critical factors in your healthcare journey. So think about what the care looks like across the continuum as you're sort of designing your plan and path forward, and figuring out how you're going to afford it, how you're going to also make space and time for it, but also how you're going to center it at the core of your plans for your pregnancy and birth.
And Dr. Shepherd, as the traditional kind of first step for a pregnant woman who would be looking for care, what is your take on women making sure that they are aware of their options and just exploring the support that is out there?
Yeah, I think when I think of support and looking at the broad system, I think from a mother's perspective, looking at the system and how we can level set and focus on creating all these social and structural factors that can help the birth process, because like Latham said, this really is beyond just the pregnancy timeframe. This really is in the postpartum phase and continuing to expand your family. And so when we have these factors that are going to be clinical and non-clinical and putting that all together, this is really the holistic view of what we think of pregnancy.
Yes, taking a holistic view, and that's why I appreciate so much both of you being here to talk with us through this. Latham Thomas of Mama Glow, Dr. Jessica Shepherd, our appreciation goes out to both of you so much.